With just 1 week to go until Election Day, party leaders are making their pledges to voters on the topic of health care. It comes as Ontario's doctors call for health care to be prioritized ahead of the provincial election next week. New stats released by the Ontario Medical Association reveal Toronto residents are waiting longer than those in other parts of the province to be placed in a long-term care facility, and longer wait times for many common surgeries. And the OMA wants to see its recommendations adopted by political parties. Joining us live tonight is Dr. Lisa Salamon, emergency physician and chair of the local Ontario Medical Association district, along with Dr. David Schieck, family physician and OMA district chair for Kitchener. Dr. Salamon, Ontarians wait about 149 days to get into a long-term care facility, but in Toronto, it's well over 200 days. What needs to be done about this?
Yeah, so it's definitely been a problem for a really long time in Toronto. And really, we need to invest in long-term care homes, but we also need to invest in home care. We need to recruit, hire, and make sure that we're adequately funding those home care and CCAC workers so that our elderly patients and public can stay in their homes for as long as possible. And really, part of the issue is that we don't have enough home care workers. And even within Toronto, it's variable depending on where in Toronto you are, how many hours per week you can get. And so if we could properly fund that, it would allow people to stay in their homes longer. If we can also fund long-term care homes, make sure that they're up to proper standards, and really ensure that we hire people to work there, we'll be able to shorten the wait times. And this needs to be priority. For my entire career, I've known that this has been an issue, but the pandemic has definitely exposed the issues that many of us have known for a very long time.
Dr. Schieck, 22 million medical services built up because of the pandemic. What solutions are Ontario doctors proposing to deal with the backlog?
Yeah, so this is one of the biggest issues that we've heard from patients coming into this election. There's 22 million services that have been delayed or not happened due to the pandemic, including 1 million surgeries. And the OMA has recommended one potential solution as being an investment in what we are calling integrated ambulatory centers, where this would take non-complex surgeries out of the stream of hospital surgeries and put them into other facilities that can do them more efficiently in a separate stream. That way, if we do get sideswiped by a pandemic, the burden that is put upon the healthcare system in the hospitals does not interfere with being able to continue to get people the surgeries that they need.
Dr. Salamon, how critical is the shortage of physicians?
We're really at a critical position right now. I mean, within Toronto, Health Force Ontario is telling us that we're at least short 629 physicians in Toronto alone. There's 1 million people in Ontario without a family doctor. You know, I want you to hear that number, 1 million Ontarians without a family doctor. I mean, this is huge. The family doctors are the backbone of our healthcare system. And without a family doctor, people are really struggling, and we see that everywhere. This is the reason our emergency departments are overflowing right now. And we have seen a lot of issues coming across. So we really need to do that. Every government, whoever wins the next election, really needs to focus on recruiting, retaining physicians, and really showing physicians the respect that we all deserve.
Dr. Salamon, just to follow up, why is there such a shortage?
You know, I think that over many years, a lot of physicians have been disrespected from, various governments throughout the years. Also, the pandemic has really burnt out a lot of doctors. We all have been working way past our capacity. People are exhausted. Lots of people are who are close to retirement are retiring. There are people who left medicine completely. And this has been just an ongoing issue for many, many years. In addition, a lot of people were leaving family medicine for 5-6 years the government didn't allow family physicians or new grads to join family health organizations. They didn't allow the formation of family health teams, which are groups that have every patient able to have a family doctor as well as all their healthcare providers as a team. And this is crucial. This is how our residents are being trained to practice family medicine. It has shown, there's evidence that it shows the best care for individuals. And without being able to join those groups, a lot of people didn't go into comprehensive family medicine. And as physicians are retiring, there haven't been the new physicians who have been replacing them. And there really needs to be a commitment to form more of those family health teams, to link physicians digitally so that physicians can easily find out information about their patients, and to allow every Ontarian to have a family physician as well as other healthcare providers.
Dr. Schieck, healthcare is being talked about on the campaign trail, particularly today. What's the OMA hoping to see in party platforms?
So the OMA has its prescription for Ontario. It's a 5-point plan that we're hoping that all of the parties can pick up. It focuses on getting rid of the backlog, which we touched on with the 22 million services and the million surgeries that have been put off since the pandemic began. It talks about really focusing and integrating mental health and addiction services better into the community. It focuses on trying to organize home and community home care services better. It asks government to better integrate public health into the broader sector and not have it siloed off. And finally, and one of the most important things that Dr. Salamon was just talking about, is really get everybody attached to a family doctor and a team and connect them with the right electronic records that everything can connect to each other.
And so, Dr. Schieck, I'll finish with you again. What's your message to Ontarians as they head to the polls next week? What's your #1 message to voters?
I would take a look at the candidates and the party platforms out there, see where they stand on the healthcare issues. We know that healthcare is actually the #1 issue that the residents of Ontario and the citizens of Ontario are concerned about. The economy is obviously top of mind as well, but you do not have a functioning, healthy economy without having a healthy healthcare system taking care of the citizens of Ontario. So really be asking your candidates about where their party and where they stand on these particular healthcare issues.
All right, a lot for voters to think about with 1 week to go until the election. Dr. David Schieck and Dr. Lisa Salamon, thanks so much for joining us tonight.
Thanks for having us.